Did you know that many owners are making a serious mistake by feeding their dogs as if they were cats? In this eye-opening video, you'll learn why your dog's digestive system requires a completely different approach, and how to properly apply BARF, raw natural food, in a safe, balanced, and effective way. Discover the most common mistakes in the canine diet, the difference between the needs of dogs and cats, and what really works to strengthen immunity, prevent diseases, and transform your dog's health. Veterinarians warn, copying the feline diet can cause serious imbalances in dogs, from bone problems to silent digestive disorders. Here you will learn what to put on the plate, how to make the transition, and what should never be done. This video is an essential guide for anyone who loves their pet and wants to ensure a long, healthy, and happy life with them. While many families share their routines with dogs and cats under one roof, a silent mistake has been spreading among well-meaning owners, believing that natural food should follow the same standards for both. But dogs and cats, despite both being carnivores, have completely different metabolic structures, nutritional requirements, and digestive behaviors. At the center of this confusion is the attempt to apply feline diet rules to the canine body, especially in the universe of raw natural food, the famous BARF model. And this can cost your dog's health dearly. The first trap starts on the plate. Many tutors who adopt BARF for their cats, which have a demanding palate, lower digestive capacity, and dependence on specific amino acids, end up replicating this same format for dogs without considering that canine metabolism has evolved into another type of challenge. Cats need higher levels of crude protein and taurine, have a low tolerance for vegetables, and metabolize fat more directly. Dogs, on the other hand, descendants of opportunistic hunters such as wolves, have a digestive system adapted to consume whole parts of prey, including skin, cartilage, organs, and even partially digested plant matter from the prey's tract. Ignoring this difference can result in serious imbalances. Dogs that consume foods with a high content of isolated protein and low inclusion of fleshy bones, as happens in many homemade recipes designed for felines, begin to have pasty stools, intestinal inflammation, calcium deficiency, and even chronic malnutrition due to a lack of bone and vegetable variety. The dog is not a big cat. Its physiology requires a balance between muscles, bones, viscera, and small doses of fermentable vegetables, such as lightly cooked spinach or squash in small portions. Another common mistake is to think that the refusal of a food by the dog is a sign that he doesn't like it. This is a logic imported from the routine with cats. The canine palate is much more open and less demanding than the feline. Refusal, in fact, is usually linked to transition errors, wrong food temperature, excess fat, or even mineral imbalance. When the tutor expects the dog to choose its food like a cat chooses a sachet in the supermarket, he is anthropomorphizing the pet, and this compromises the therapeutic function of the BARF diet. Nutritional science has shown that dogs absorb phosphorus better when it comes from raw bones and cartilage, rather than from pure meat. Cats, on the other hand, do not have the same ability to break bone, nor do they need the same proportions. Instead of using expensive supplements to correct these mistakes, the canine owner should learn to set up the diet based on what the dog's body really demands. Ideal proportions between muscle meat, bones with meat, such as chicken neck, offal in small amounts, and fermentable vegetables to improve intestinal transit. Another critical point is management. While cats eat in small portions throughout the day, a behavior inherited from solitary felines that hunt several times, dogs adapt better to occasional meals, such as 2 a day. This directly affects the digestive fasting time and enzyme production. When the owner offers snacks or small portions of homemade food all the time, it ends up interrupting the dog's digestive process and causing chronic inflammation in the pancreas. A common misconception, fueled by excessive humanization, is to treat the dog like a hungry child. But he needs breaks to digest, absorb, and activate his enzymes and phases. There is also the difference in the production of saliva and stomach acid. Cats produce less saliva and chew little, which requires the meat to always be in small pieces. The dog, on the other hand, is able to grind bones easily, produces more gastric acid, and has a robust digestive system to handle raw food in large pieces. Adapting the texture of your dog's food based on cat guidelines can cause your dog to swallow poorly chewed pieces, cause choking, or suffer from abnormal fermentations in the intestine. Veterinarians specializing in functional nutrition warn it is common to see dogs with excess protein in their urine, frequent flatulence, or inconsistent stools after diets that copy the feline pattern. What seems healthy at first glance, such as pure muscle meat or prime cuts, may actually be low in collagen, low in minerals, and lacking the bone density that the canine body expects. It's like feeding a sea lion salad. It looks pretty, but it's not functional. The BARF needs to be functional, physiological, structured according to what nature has designed for the dog's body. In the transition to BARF, many tutors take the wrong path. They change the feed for pure ground beef or for lean cuts without bones, inspired by feline recipes, which causes an abrupt drop in the mineral balance, especially calcium and phosphorus. The result is clear: muscle weakness, joint pain, and even fractures in puppies or the elderly. The correct thing would be to gradually introduce raw fleshy bones, such as chicken necks or meaty beef ribs, combined with second-rate meat, cooked offal, and fibrous vegetables, creating texture and variety for the gut to learn to respond to. And that's where the biggest myth comes in. But my dog eats like a cat, only small portions. This perception is the portrait of maladaptation. When the dog is uncomfortable with the diet, he will naturally reduce his intake. The owner interprets this as he prefers to eat like a cat, when in fact the animal is refusing because the food is unbalanced, bland, too cold, or poorly formulated. Instead of correcting, the tutor insists on serving in smaller quantities, increasing fasting, digestive stress, and the risk of pancreatitis. The key is in the formulation, not the quantity. It is necessary to understand that BARF is not synonymous with raw meat only. It's a complete model of ancestral food, based on what the wild wolf would eat in the wild: whole parts, collagen, natural fat, minerals, digestive enzymes, a semi-digested vegetable gut, crushed bones, and a chew that activates all of the animal's senses. When the tutor replicates the idea of the feline sachet or the clean fillet, he delivers a partial diet, and partiality is the enemy of canine longevity. Social media has popularized the image of dogs eating clean cuts of raw filet mignon on porcelain plates. But the reality of canine metabolism calls for something rougher, closer to nature, more functional. While the cat is a solitary gourmet, the dog is an opportunistic carnivore. And that changes everything. Understanding why a dog shouldn't eat like a cat is more than a matter of nutrition labels. It's an exercise in biological responsibility. Dogs have teeth adapted to crush bones and tear flesh into large pieces. Its jaw does not perform lateral movements like that of felines, which are precision hunters, focused on small prey and localized bites. The dog devours, the cat selects, and the difference starts there, in the mouth. Canine saliva contains enzymes capable of initiating the digestion of starch, something that cats do not do efficiently. Because of this, a BARF diet for dogs can contain minimal and strategic amounts of cooked vegetables, fermentable roots, and even specific fruits like blueberries, which help offer fiber, antioxidants, and digestive texture. In the case of cats, these insertions should be avoided, as they can interfere with the absorption of essential nutrients. To confuse the two worlds is to assemble a dish that serves neither. Another determining factor is the volume and frequency of meals. A cat needs several small portions a day to avoid hypoglycemia and keep the digestive tract active. The dog, on the other hand, needs breaks, a system that knows how to work with intermittent fasting, including benefits already demonstrated in longevity and metabolic health. Dogs subjected to constant meals as if they were cats develop insulin resistance, accumulation of visceral fat, and often behavioral changes such as irritability, agitation, and food apathy. The problem is aggravated when tutors try to improve the dog's taste with artifices used for cats: sauces, broths, concentrated aromas, or meats that are too soft. This turns the dog into a selective eater, and selective dogs get sick more, precisely because they reject the variety that BARF requires. When a dog learns to eat only shredded chicken breast, rejects liver, does not accept neck, twists its muzzle to vegetables, or refuses cartilage, it is not being demanding. He is being poorly conditioned. The ideal structure of the canine BARF diet is made up of 5 pillars: muscle meat, between 50 and 60%, raw fleshy bones, around 20 to 25%, offal, 10%, fibrous vegetables, 5%, and natural supplements when needed, such as nutritional yeast, seaweed, or fish oil. When this composition is deviated, and the tutor adapts under the influence of the feline model, there are real consequences: deficiency of zinc, calcium, vitamin D, and even an increase in the risk of dermatitis, hair loss, and joint inflammation. The confusion between feline and canine diets also occurs when calculating the calorie content. Cats have slower basal metabolisms, require less energy per pound, and have a low tolerance for excess fat. Dogs, especially active breeds, need more calories and can metabolize fat efficiently. Adapting the feline diet to the dog can cause weight loss, a drop in immunity, and an increase in food anxiety. Instead of delivering satiety, it delivers lack. It is essential that the tutor understands. The dog needs to bite, grind, activate jaw muscles, stimulate the nervous system with textures. That is why BARF cannot be served in pâté, in mousse form, or with a sachet texture. This works for cats, whose sharp teeth make quick cuts and minimal chewing. For dogs, this frustrates the instinctual process, generates anxiety, and prevents complete neuromuscular activation during the meal. Eating is also a behavioral process, and when misapplied, causes mental imbalance. Another aspect that differentiates the species is the use of organs. Dogs can digest larger amounts of liver, heart, and lungs as long as they are well distributed throughout the week. Cats are extremely sensitive to excess liver and can suffer from vitamin A poisoning more easily. Therefore, while the feline diet requires strict monitoring of each gram, the canine BARF diet allows more room for practical adaptation, as long as it follows correct proportions. And when we talk about bones, the difference is striking. Cats should be given virtually no large bones, while dogs rely on them to clean their teeth, balance calcium, develop jaw strength, and maintain satiety. The absence of bones in canine diets causes soft stools, cavities, bad breath, increased stomach acidity, and bone weakening. And unfortunately, many owners stop offering them out of fear, ignorance, or because they think that dogs don't need it anymore, which is a serious myth. Dogs also have a different gut microbiota. A healthy dog's gut is able to handle dietary variations, cartilage remains, traces of animal fat, and small amounts of fermentable fiber. The cat, on the other hand, has a shorter and more sensitive digestive tract, which requires very highly digestible protein and little intestinal fermentation. Therefore, the inclusion of fiber and vegetables in canine diets is beneficial and dangerous for cats. A simple modeling error can cause diarrhea in one and constipation in the other. These differences become even clearer in times of illness or recovery. While a cat with kidney failure needs a diet with low phosphorus and high digestibility, a dog with the same condition benefits from a diet with balanced phosphorus, high humidity, and inclusion of collagen and good fats. If the tutor copies the menu from one to another, the risk of aggravating the clinical condition is high. The mistake is not in the intention, but in the lack of knowledge. And all of this brings us to the central point. Canine BARF must respect canine biology. It is not enough to be natural, to be beautiful, to be homemade. Nature doesn't care about appearance. Nature cares about function. Bones to clean teeth, viscera to provide vitamins, vegetables to modulate the intestinal flora, meat with fat to offer slow-release energy, and texture to activate instincts that are also part of the animal's mental health. A dog that chews is a more balanced dog. Turning a blind eye to it, or mimicking a cat's diet out of convenience, laziness, or lack of guidance, is turning BARF into a mistake disguised as caution. It is delivering the right label with the wrong composition. And, in the long run, this is what generates the problems that the owner does not understand. Dermatitis without cause, unstable stools, apathy, food anxiety, itchy paws, and even food rejection. None of this starts from nothing. It all starts on the plate. And the right dish is not inspired by what the cat needs, but by what the dog was born to digest. Behind the scenes at veterinary clinics, a pattern is beginning to draw attention. Young dogs with bone problems, adults with unexplained power outages, and elderly people who lose weight despite eating homemade food. In many of these cases, when the veterinarian investigates the diet, he discovers that the owner is serving meals assembled with feline logic. Lean cuts, lack of bones, absence of viscera, and inadequate texture. These are beautiful recipes to the human eye, but far from what a dog needs. And the body charges. The false idea that everything that is good for cats is good for dogs also contaminated natural nutrition influencers who, for fear of public rejection, began to soften BARF, removing viscera, removing bones, avoiding fats, until the dish became an innocuous mixture without biological potency. This trend, while well-intentioned, is spawning a generation of muted, malnourished dogs. They eat, but they do not nourish themselves. They lick the plate, but they don't get what the body begs for. The owner who understands true BARF knows that it's not just about food. It's about giving the dog back what his body recognizes as legitimate fuel. The chewing of the bone, the smell of the liver, the texture of the meat, the digestive challenge of the vegetable. Each of these elements triggers physiological, neurological, and immune sensors. It's like restarting a system so that it works as it should. And when this wheel turns well, everything changes. The fur shines, the breath disappears, the disposition returns, the intestine stabilizes, and even the behavior improves. And that's exactly why your dog shouldn't eat like a cat. Because he is not. Because your body asks for something else. Because their digestive structure, their metabolism, their mouth, their teeth, their gut, and even their ancestry speak a different language. The tutor who hears this language and stops projecting the feline's selective behavior onto the dog gives the animal more than one meal. It gives health, balance, vitality, and presence. In practice, this requires attitude. It is not enough to buy chicken breast and offer it as natural food. It is necessary to learn how to put together a functional menu. Include raw, fleshy bones at least 4 times a week. Alternate types of meat, chicken, beef, fish, lamb. Insert specific viscera in small amounts, liver once a week, heart twice or 3 times, lung or kidney in strategic portions. And don't forget vegetables. such as boiled carrots, slightly heated spinach, diced pumpkin, which help with intestinal fermentation and stabilize digestive pH. The temperature of the food also matters, always close to room temperature. Avoid serving straight from the fridge. Cold food inhibits enzymes, causes cramps, and increases rejection. Texture is also key. Large pieces, fibrous flesh, bones with strength. The dog needs to chew, need to activate. You need to live the meal, unlike the cat, which prefers small cuts, little resistance, and greater temperature control. Giving the dog the same as you give the feline is frustrating your pet's biology. Finally, remember to review the diet with a veterinary nutritionist. BARF requires a balance of calcium, phosphorus, zinc, vitamin E, B12, and omega-3. Natural supplements can be allies, such as sardine oil, nutritional yeast, or dehydrated seaweed, but they should not be used to compensate for basic errors. The base needs to be correct, and this base is not that of the cat. It is that of the dog. The reward comes quickly. In a few days of well-formulated BARF, dogs stop scratching, sleep better, have a consistent bowel movement, have less gas, and gain sparkle in their eyes. Within weeks, the hair regenerates, the muscles respond, and the temperament is more balanced. Within months, chronic diseases begin to regress, immunity increases, and aging slows down. All this because the tutor respected what the animal's body asked for, and not what seemed easier, more beautiful, or more similar to what the cat eats. Respecting differences is the greatest form of love a tutor can offer, because each species carries its own wisdom. And the role of the human is not to interfere, but to facilitate. The dog is not a mini-human, and it's definitely not a big cat. It is an animal with an ancestral food history which can, and deserves, to eat as such again. And when this happens, it is not only the body that improves. It is the bond between you and your dog that transforms.